I think what differentiates SENA is we truly meet patients where they are and go upstream. A lot of programs focus on just one thing, whether it's delivering hospital care at home or whether it's helping employees navigate healthcare or whether it's cancer care, cardiology care, or urgent care at home, for example. And I think what we do at SENA differently is that we really cover the whole gamut of care.
Welcome to Business Ninjas, brought to you by WriteForMe, where you'll hear from business leaders who are out there growing their business and slaying it every day. Learn from the masters. Let's get started.
Hi, and welcome to another episode of Business Ninjas. I'm here today with Dr. Anthony Wehbe, founder and CEO of SENA Health. Dr. Wehbe, how you doing this morning?
I'm doing great, Andrew. Thanks for having me. Appreciate your time.
My pleasure. I appreciate you spending some time with us on Business Ninjas. Please tell us a little bit about yourself and about SENA Health.
Sure. So we're a Philadelphia-based company. I'm a physician by background, practiced internal medicine, really the whole gamut of internal medicine. So working in the hospital, working in nursing homes, outpatient primary care, telemedicine, and even doing house calls. Some of my favorite times as a student and in my training as a physician was doing house calls in South Philadelphia with old Italian ladies and meeting them in their home and bringing care to them. So in addition to that, I would describe myself as a self-proclaimed tech geek. I love technology. I've always incorporated technology into how I deliver care, and it's just incredible how technology continues to evolve in the day and age we are in currently. So I worked as a physician, then as a healthcare physician executive here in the Philadelphia area, and then started SENA about 4 years ago, bringing my passion for caring for people at home and technology together into a company called SENA. And the purpose of SENA is to truly radically transform the patient experience and improve on how patients experience healthcare. And that's how we went out to market, starting out with hospital at home at the peak of the pandemic and bringing hospital level care and high acuity care to people in their homes, leveraging technology and operational innovation. So
Excellent. And how are you delivering those services? I assume we're talking about telehealth on the front end, but when you get to acute care in the home, how do you accomplish that?
So the core of our business is this clinical command center that's 24/7, 365, available on demand to patients, to doctors, to family members, to our partners. There has to be a core air traffic control, if you will, that's reliable and always there. So everything runs through our clinical command center. All of our services runs through that. We leverage technology. We have an in-house technology team of programmers and developers where all of our coordinators and all of our team members and leaders leverage technology, automation, AI into how we operate and how we function. So it all starts there. That's our really heart and soul. And it's called our SENA Health Core. That's our command center. From there, we deploy devices into people's homes. We don't manufacture any hardware, but the pace at which the hardware is evolving is truly incredible. Things like remote patient monitoring, watches that people can wear in the home to track, and Apple Watches and Samsung, Google, those are common things, Fitbits and things like that to give you an idea. But the technology is advancing so much that you can track if a person falls in the home, if their heart rate is abnormal. So we put devices into people's homes, and that connects by cellular to our command center. So yes, telemedicine is part of what we do, certainly to connect with people by video, to be able to examine people remotely. But we also have to deploy people in certain circumstances because you can't do everything by telemedicine, right? You can't put in an IV and administer a medication by telemedicine. So that's the connection from the community, is leveraging technology into our clinical command center that's available 24/7.
Excellent. And And your clients are these people who are aging, or the sort of people who are hesitant to leave the house and go to the doctor? Who are you serving with this platform?
Yeah, so yes, the majority of our patients are of the elderly demographics, and certainly as a nation and as a country, we continue to grow older. Every day, 10,000 people turn 65 and older, and we're not going to have enough people to care for those that are aging if we don't innovate and change the way we deliver care and how people experience care. But that's not to say that we don't have younger people. I mean, we've had uh, I remember, recently a patient that was 38 years old that had a really bad bout of pneumonia, COVID still, and on top of that had a bacterial pneumonia. He saw his doctor for 2 weeks. He has three little kids. He works at a local gas company here. And his doctor did a CAT scan and said, look, you need to go in the hospital because you have a bad pneumonia and the pills we're giving you aren't working. So he ended up going to the ER, and we ended up treating him in the home where I was his doctor. I still practice. And as I was talking to him, I saw his three little kids running around at home. He had an IV getting medications. The nurse was there at his bedside. So we have younger populations as well. And also we do a lot of work with people with intellectual disabilities as well, people on the spectrum in group homes, so we can also bring care to them as well. But the majority, Andrew, you're right, are the elderly aging population. Those are most of our clients.
Excellent. And other than basic access, which of course is the most important component, what are the most common problems you're solving for your clients?
So access is a major, major issue, right? How do people access healthcare? How unfortunately, a lot of things in healthcare today are very siloed. You have a subspecialist to the subspecialist that does only one thing. Unfortunately, there aren't a lot of generalists out there that can help people navigate. So, one is yes, we help, like you said, improve and change the way people access healthcare, but more importantly, give them access to care where they have someone. One of the metrics we keep track of in our command center is speed to response, speed to answer, whether it's a phone call, text message. And that's something our goal is within 14 seconds. If you're calling us, we know it's important that a human being gets on that call or responds to your message so that you know there's always someone there. So we've invested in that technology. So in addition to access, what we're really solving for is how people experience healthcare. I'll give you an example. So just to elaborate on that, the average consumer of healthcare, regardless of education, understands healthcare at a fifth grade level. And that's no knock on anyone's education. It's just how healthcare is so complicated. I mean, I know physicians and some, neurosurgeons that struggle with getting the right care for their own family members when it comes to it. So it really takes a lot of work to understand healthcare and then explain it to a person and their family members at a level that they can understand and make an informed decision. So I think those are the two things we're solving for: is access is big. That's a major problem we have. And then two, it's understanding healthcare and how to consume healthcare or use healthcare as a well-informed patient and family member.
Excellent. Excellent. And I assume there is some competition in your space. There has to be. And what differentiates SENA Health? What makes you stand out from your competition?
Yeah, Andrew, there's not enough competition. We are just touching the surface here of bringing care to people where they are. And there's some incredible people in our space doing amazing things, even pre-pandemic, during the pandemic, and post-pandemic. And really, it's a community of people out there. They're trying to support each other. And the whole concept of really what we're doing here, Andrew, is that concept of care anywhere. People now, like, you and I are having this conversation where probably before the pandemic, it'd be a little bit more challenging to make this the norm. And culturally, we've changed in how we consume things, right? Whether it's how we get things delivered to our homes, or how do we go to events, how do we communicate, how do we work with each other. So healthcare is not immune to that. And uh, there's a lot of people trying to solve for that concept of care anywhere and bringing care to people. Telemedicine is just one part of it. So yeah, there are competitors. I don't look at them as competitors. We're all trying to do the same thing. I wish more people, more hospitals, more doctors and medical groups get into this concept of meeting patients where they are and meeting their families and bringing care to them, as opposed to the opposite, where we've built this large institutions and expect people and their families to come there to consume healthcare. I think what differentiates SENA is we truly meet patients where they are and go upstream. A lot of programs focus on just one thing, whether it's delivering hospital care at home or whether it's helping employees navigate healthcare or whether it's cancer care, cardiology care, or urgent care at home, for example. And I think what we do at SENA differently is that we really cover the whole gamut of care. At the core of what we do is our clinical command center. That enables, sure, we can do hospital level care at home, or we can go all the way to just deliver vaccines in the home and help someone understand their care as an employee. So we do a lot of work in the employer space where unfortunately a lot of employers are struggling and their employees spending a lot of money on healthcare for their employees, and the experience is just terrible. So again, I think that's what differentiates us. And look, we're not trying to be everything to everyone, but what we really do well is that clinical command center. That's our heartbeat of how we enable all the models of care that we have.
You used a phrase that I use every single day in the context of what we do here at Write For Me, which is that you have to meet people where they are, whether it's medical care or your content to educate and engage people and teach them who you are. Tell me what role content has played in the growth of SENA.
So one of the major things I tried to hardwire when we first started Center from the very first person we cared for, Linda, was to constantly get feedback and create feedback loops in our organization. And our North Star and number one feedback is our patient experience and the testimonials we get from patients. So we hardwire that from day one in Senna. And the testimonials we've gotten, Andrew, are just second to none. Look, I've been a physician for 17 years, and a lot of my practice, whether I was a hospitalist, working in the hospital, or in an office, um, people don't want to end up in the hospital. They're not happy to be there unless you're having a baby or delivering a something happy. But if you have a broken bone or you have a heart attack, stroke, you're not happy being in the hospital. I've seen the reverse when we've met people at home. Like that 38-year-old gentleman with pneumonia, he wasn't feeling well, but he was so thankful to be at home with his three daughters running around and just being able to be home with his family. And that content, I think we're not doing a good job always capturing it. We can certainly always improve and do better. But those stories is what drives us, is what we should get the word out on and inform people that there's a different way to experience healthcare that's very different than what we're used to. So I truly believe in that, capturing those moments, that content, and spreading the word. So we'd love to have your help with that because we're a healthcare delivery company and we're a tech company as well. So we're not good at that. So we'd love to get your input on that and support.
Hey, we'd be honored to help people thrive. Talk about talk about the COVID years for a second. Now, you said you launched the business 4 years ago, is that right? So
Yes.
COVID was an atom bomb on the world in terms of how we go about things, but it sort of fell into your lap in terms of your business model. Tell me about the challenges and opportunities of growing a business through COVID.
Sure, sure. So yeah, we started the company April of 2020. So I, left my other job prior to this, a couple months earlier, and then yeah, the pandemic hit. My wife is an infectious disease physician, so she was in the heart of it. We have four kids at home. We didn't know what was going on, so it was really chaotic. Um, Especially my wife, she was, at the true front lines of COVID. We had, ground zero. The first patient, I'll never forget, she came home and was like, wow, we're all in shock. We're trying to figure this out. And so we were at ground zero for COVID. When I started SENA, when, went out on my own with my partners, I have two other partners that were instrumental in starting the company with me. Our goal, and people ask me, what business are you in? And yeah, we do hospital at home and we do, advanced care at home and help employee navigate care. But the business we're in is to truly and radically transform the patient experience. We really do. And we want to bring care to people and meet them where they are, leveraging technology. So that's the business that we're in. I've always been familiar and loved the idea of hospital at home. Again, most of my career as a physician was as a hospitalist. So that's a specialty where people come in the hospital, I take care of them for a few days and then get them back home in the community. So um, looking at our North Star of radically transforming healthcare, I'm very personally very passionate about helping people age in place, love technology. And there was a need back then because we were telling people, if you remember, especially here in the Northeast, stay away from the hospital, don't go to the ER unless you're really sick. And then we had really sick people just stay at home and being afraid to leave the home. So through my network of doctors that have been doing house calls for many years. Dr. John Daly, I'll give him a shout out. He sent us our very first hospital at home patient. And that's how we started getting more referrals and more people sending us patients. Again, that was, it helped the business, but also helped us learn. And by the way, Andrew, there was no payment model for this back then. We didn't go into this to try to get paid or make money. We really, truly wanted to transform the healthcare experience. And we went into this, learning, leveraging technology, building technology. And then later that year in 2020, November, the Wednesday before Thanksgiving is when Medicare, the government, the largest payer in the country, said, we're going to pay for hospital at home. So since then, it's really been a movement, and a lot of people have come into this space now that there is a payment model. But when we started this, Andrew, we weren't getting paid. There was no pay. We were just trying to do the right thing for people and bring them care during the pandemic.
Well, it's an honorable endeavor, especially since it wasn't particularly lucrative for your first year in business. I appreciate the fortitude. All right, let's look down the road a year from today. What are some things you'd like to be celebrating personally and professionally?
Yeah, so wow, that's a great question. Especially now, beginning of the new year, we all have our New Year's resolutions. I try not to fall into that, but I do like to plan. I am a planner, so I always have my personal goals and my business goals that I plan for the year. So personally, my personal North Star is always my family. That's my purpose. That's my why. My children, my family. So have those personal goals certainly to achieve as my kids are getting older. And all just healthier. I always aim to live a healthier lifestyle. So I have my personal goal there. Training and then getting healthier there. For work, we have some plans this year to get the word out. I have a dream that, one day I wake up and we have 10,000 people. I don't know why that number, it just sounds like a number woke up or we were planning back in 2020. Wake up and there's 10,000 people that will be at home getting hospital level care in the home and not in a physical hospital bed, especially since now a lot of our hospitals around the country are faced with limited resources. The hospital beds are full. We're actually, thankfully, COVID is not as bad now as it was before, but there's still COVID out there. There are people that haven't taken care of themselves for years that are seeing the ramifications of that. Um, so I'm hoping, as we progress through the year, the word gets out and hospitals, doctors, insurance companies, really they're the ones that can drive this, realize the benefit of this. And there's a lot of studies coming out, a lot of legislation coming out supporting this type of care in the home. And we have more and more people getting more care in the home, not just hospital level care, but other types of care in the home where otherwise they would have been forced to go to a facility and office. So yeah, that's our plan for this year, is continued growth.
Excellent, excellent. Please tell everyone, what's your URL? Where can people find SENA Health, and what social media outlets are you using as well these days?
Sure. So senahealth.com, SENA health.com. That's our main website. There's a lot of information and content there on the type of care that we deliver. We also very routinely post updates on LinkedIn, trying to communicate with our colleagues there, our business partners, and other people in the healthcare industry. And then publicly, socially, we use Twitter or X as more content that's public facing. So those really are our website, LinkedIn, and then X.
Excellent. Dr. Anthony Wehbe of SENA Health, thank you for spending some time with us today on Business Ninjas. I thank you for what you do. All the best to you and yours for continued health and success.
Thank you, Andrew. I really appreciate the time and I enjoy the conversation. We have an amazing team at SENA that are very, very committed to our North Star of helping people get more care in the home. So really, that's what gets me going every day, is our incredible team. And the future looks promising, and good luck to you as well, Andrew. Thanks again.
Thank you so much. Be well.
Thanks.